Hello and welcome to today's episode. We will be covering mean flow rate. We have earlier presented the average phonation airflow to you. It's also called phonation quotient and is vital capacity in milliliters divided by maximum phonation time in seconds. The mean airflow rate can be measured by using pneumatograph. This consists of a handheld mouth tube, possibly connected to a mask, within which is placed a fine mesh wire screen in order to create a small resistance to airflow. This resistance results in a pressure difference across the screen and can be measured with a differential pressure transducer. The pressure difference increases with the flow. This device provides a direct measurement of the mean airflow rate in milliliters per second for sustained phonation over a comfortable duration, usually 2 to 3 seconds, at the habitual pitch and intensity level, following habitual inspiration. If you want to measure flow rate, you have to use one of the modern measurement setups referred to by Jack Young. We have been involved in the development of the aerophone made by FJ Electronics. Rothenberg made his mask many years ago, and Glottal Enterprises developed it further. Problems with these measurements are accuracy and precision. As for the precision, there are extremely high intra-subject variability, instability to sustain constant phonation, reflex response of the larynx, and varying frequency levels. Several dedicated devices are commercially available. For example, the Phonatory Aerodynamic System PAS 6600, K-Pentax. They propose various protocols, including an estimation of voicing efficiency. Due to lack of precision, we have not used this method very much. How to develop the machinery so the precision becomes better is a big question. Still, we try to make measurements on 12 normal Danish males and 18 females between 20 to 40 years of age on a sustained tone. The average mean flow rate showed a difference between males of 204 milliliter per second and females with 178 milliliter per second. We made our measurements with the aerophone constructed by FJ Electronics. The reason we have complemented the mean flow rate with the other parameters is that to some extent this defines the material of the clients, so that the precision is a little bit better. But note that the standard deviation are not included because they are too big to be of interest. We have made a big study on 16 brain damaged male clients with an average age of 35, and we have correlated the airflow measurements with phonetograms. It's very interesting to see that there is no correlation between the phonetograms and the average airflow velocity and phonation quotient. Problem is that the standard deviation is rather high. As presented in our own studies, there is a rather big variation between subjects. It is well known that intra-subject variability is also very high. So that is one of the problems that might be solved in the future, where the possibilities to make these measurements is much bigger with artificial intelligence. The measurement is of extreme value to document pharmacological treatments if they're exact enough. It is interesting that airflow in the future probably can be used during running speech. In the first study, they used the equipment from Pentax to define the running speech versus sustained phonation. The second study is of singers and are of great interest. Unfortunately, pathology is not discussed in this paper with evidence-based procedures. Thank you for watching, and we'll see you in the next one.